So we spoke about seizures, right? And being an obstetrics and gynecology channel, we focused on some type of seizures that individuals might have in pregnancy. That's what is known as eclampsia. So in eclampsia, we're talking about hyperreflexia. So I just want to just break down the concept. So what is hyperreflexia? So you can see this is hyperreflexia. Okay, this is it. It's just a component of seizures. You understand? So this is a condition where your body's reflexes become too much, exaggerated, overactive. That's what makes you, jitter. So it's often a sign of there's an underlying issue with the central nervous system. Particularly, it is affecting your upper motor neurons. All right. So upper motor neurons are the pathways, are the nerve pathways that carry signals from the brain to the spinal cord. You understand? So what causes hyperreflexia? What could help you make you have this hyperreflexia? So if you have neurological conditions like multiple sclerosis, amyotrophic lateral sclerosis, somebody that has stroke, somebody that have injuries in their spinal cord, do you understand? We'll talk about each one of them later on. Then sometimes it could be issues, but these issues are not linked to problems with your nervous system. Like, let me say somebody is anxious, the thyroid gland is overactive, serotonin syndrome, all right, electrolyte imbalance, certain medications or stimulants. Okay, so types of reflexes affected: patellar reflex, so knee-jerk response may be exaggerated. Actually, you understand? So ankle jerk can be there. Autonomic hyperreflexia, this one is just affecting the whole body. All right, that one is much more dangerous. So diagnosis is deep tendon reflex, where they want to use all this patellar hammer to elicit reflexes. So they just touch you, hyperreact. They just know that it's there. Then they will now access your whole nervous system to just see. You understand? So treatment is you address what is causing it. We listed a whole lot of things here that could possibly cause this issue. So of course, if you treat what is causing it, you treat the hyperreflexia issue. Then you manage any nervous system issues. You adjust medication. Sometimes it's side effect of some drugs. All right. If this thyroid gland, treat it. All right. Then sometimes you have to do all this physical therapy like massaging and all of that. Okay. So this is just what hyperreflexia simply means as a concept.